Okay, so let me set the scene for you. So, penetrative intercourse is not the most comfortable. Even like OBGYN exams are not the most comfortable. You go for your annual, or maybe you're just going to your OBGYN because this has been a problem and you're tired of it. And you're like, hey, doc, my vagina hurts when I go to have sex with my partner and it's not fun and I can't stand it. So your OBGYN gives you a dilator and is basically like, have a glass of wine, relax, and go play with this thing. And that's all the instruction you get. And you try it, and that also sucks. Why does it suck so much? And how can we make it suck less? That's what we're talking about in today's video. Before we go on, ethically, I have to say that if you are new to dilator training and you have no idea what to do, and this is your first rodeo, please reach out to your friendly pelvic floor physical or occupational therapist who can help guide you in a self-treatment plan that is appropriate and individualized for your body. So, what exactly is the purpose of this thing? Dilators are one of many tools to have in your pelvic floor toolbox to help relax your pelvic floor muscles and also your vaginal tissues and the entrance to your vaginal canal. And as a quick review, this is your pelvis, and all this pink stuff here is pelvic floor musculature. So the dilator essentially works, and you'll notice me pause and you'll understand later down the line. It essentially helps to relax these muscles because if they're too tight, that is preventing anything from giving you any kind of penetration, whether that be a tampon, a partner, during an OBGYN exam. All if these muscles are tight, they're going to fight whatever is trying to come in through the vaginal canal. And this is the vagina right here. So dilators also help to stretch these tissues. And it's a fallacy that this needs to be tight as possible because part of the reason why you might be having difficulty and discomfort and pain with penetration might be because these muscles cannot relax well and thus they don't have the best stretch to them. And that's what we are trying to navigate with dilator training. Dilators come in different materials, like I mentioned earlier. So I'm going to be demonstrating with a silicone-based one. If you got one from your MD or a hospital, they probably gave you that like hard plastic. That's another thing. And there's also dilators that are made out of Pyrex, which is a glass-like material. This is kind of like somebody said that it was like finding their favorite pair of jeans where there's a lot of trial and error. And this is exactly what dilator shopping is like. So if the ones you got from your MD aren't cutting it, you might want to try a silicone based one or a silicone one. And if that's not cutting it, maybe a Pyrex is more your jam. It all depends on what's comfortable for your body and what feels good because they all do have different feelings. I personally prefer the silicone based ones just because they're like, they have a little bit of give to them and they're not so rigid, but they also feel like skin, so it's a little bit more comfortable. Another thing to keep in mind is that dilators come in all different sizes. You don't have to start off with the medium size right off the bat, even if that's what your MD gave you, if especially if it's not comfortable for you. So I'm just going to show you what my variety looks like. So it goes as big as this and it's as small as this. So I am an affiliate with a company called Intimate Rose. I actually reached out to them to become an affiliate because I love their product so much. And they gave me sets of dilators to show my clients to see what might be appropriate for them. We don't use them on clients. These are just for show. This is a educational piece in that do not share your dilators, please. This is just for you and you only. But just to show you kind of the variety here, I don't know if you can really tell from the box, but this is what the full set looks like minus those two that I took out. So they come in all different shapes, all different sizes, and you are free to start with whatever is comfortable, especially if this is brand new to you. Just shoving things inside and hoping for the best is not going to cut it. And we are going to talk about technique in this video next. First things first, make sure you go somewhere where you can be alone and uninterrupted. And for those of you who are parents, I know how difficult that that is, but make sure you want to be in the zone. You want to be able to relax. You don't want to be answering somebody who's banging down the door. So a lot of times I'll have my clients try in a bathtub with their backs resting against the back of the tub and they're reclined in the bathtub because that's the place where they get the most peace. You might want to use your bedroom for that. Lock the door. You can turn the lights down, do whatever you want to help you get the most relaxed. I don't want you to numb this experience with inebriation. Okay. I don't want you to get drunk. I don't want you to get stoned and just zone out while this is happening because that's not helping anything, right? We want to be able to enjoy things like penetrative play again. And if our minds are out of it, that's not teaching our nervous system and our bodies anything about how to accept things that are being introduced to that area of our body. And it's just masking stuff. And we don't want that. We want the full body experience. We want our nervous system. We want our ligaments. We want our muscles to accept willingly what is coming towards them, literally. So that being said, make sure you're nice and relaxed. Make sure your hands are clean. You might want to try a lube for these, and I do have recommendations on which lube to use. I am a big fan of water-based lubes. And those are safe to use on any type of material that your dilators are made of. And the cleanup is pretty easy and it doesn't stain. And I am not affiliated with these companies, but I usually recommend Slippery Stuff and Good Clean Love. Those are my top two. And I really, really like those. Other lubes are silicone-based lubes, which are longer lasting compared to the water-based ones. So you need to wash these off with soap and water. You should be doing that anyway. But silicone-based lubes are not to be used on silicone-made dilators, okay? Because it can break down the silicone in the tool and damage the tool, and we don't want that because these are expensive. And there are also oil-based lubes who can be a little bit messy and they can stain, but they are the friendliest to sensitive skin and the least likely to be irritating, but they cannot be used with condoms, side note. And they should not be used with silicone tools either because it's really hard to clean them off and then you risk not the best things happening, like bacterial infections and toys breaking down and all that. And we don't want any of that. Before we even think about picking that tool up, we want to make sure that the pelvic floor is prepped and relaxed because it's not going to be very happy if you just start going at it with something that it doesn't have the best history with, right? So we want to make sure that we do what's called nervous system down regulation, which essentially is breathing and getting us into a nice relaxed state, increasing our parasympathetic response, which is essentially lowering our fight or flight. Okay. So while you're lying there, or even while you're just watching this video, you're going to have a hand on your chest and a hand on your lower belly, like under your belly button. And we're going to practice inhaling and exhaling. Everything should be relaxed. No shoulders hiking, no forehead scrunching. This hand remains relatively quiet. So we're not getting chest expansion. We're getting a lot of the activity from the hand on our bellies. And I'll stand up and show you what this looks like once we go through a couple. So you're going to close your eyes if you want, and we're going to practice just breathing and making our nervous system chill. So you're inhaling and filling your belly up with air as low as you can, expanding your ribs on the inhale and not pushing down, and exhaling all of the air out. And we're going to try this 5 times and I'll show you what it looks like from the side. So inhale, fill your belly up with air. Exhale, all of the air out. Nice. Oh, I got lightheaded on that one. We're going to try again. Inhaling, filling belly up with air. Exhaling all the air out. Inhaling, filling up with air. Exhaling all the air out. Inhale, fill up with air. And exhale all the air out. And when I say low low inhale, this is what I mean. So I'm going to stand up and show you. I don't know how well the microphone's going to work from here, but we make do with what we have. So if you look at my belly, let's come here. There we go. So I'm inhaling. See how that's going low? Inhale. One more. And if you want more instruction on breath, I do have a breathing video on this channel, so make sure to check that out. So now we're all nice and relaxed, and now we are going to try to use the dilator tool. So the first thing we're going to do, we're not going straight for the gold right away, especially if this is your first time, and especially if you've tried this before and you're like, I hate this. This is the worst thing ever. We don't want that. We don't want to scare, I don't want to scare you. I don't want your nervous system to be like blocking this. And I want this to be as enjoyable of an experience as it can be, even though that's weird, or it sounds weird, I should say. There's nothing weird about it, but we want this to be as chill as possible. So what we're going to start with is you're just resting the dilator at the entrance. You're just resting it. We're not pushing it in. We're not doing anything. And you're going to try to do that at different levels of it's called introitus, which is your vaginal opening. So you're going to put it at the bottom. You're going to try to just move it, and we're just resting it there. It's not going anywhere. We're just getting our skin and our vulva used to what that feels like. We're getting it used to being near something that it has an extensive history with. And we're letting your nervous system know essentially that it's okay for this to be happening. And we're going to do this on the left and the right sides because you have a left and a right side of your vulva. And if you want, we're just resting. We're not putting anything in anywhere yet. You're going to give a little bit of pressure if you're cool with that, if that feels good to you, if your nervous system is like, yes, I am good with this. This feels good to me. I am chill as a cucumber. You're going to put a little bit of pressure, and we're going to do that all along this, essentially it's the vaginal canal and slash vulvar tissue. Okay. So give that a go, see how that feels. And then I'll meet you back with expansion on technique. Okay, so now we're on to the next step. And this is every step that you're going to progress depending on how you are feeling with this. So if that first step was like, you're like, that was a lot, I haven't done that in a while, it's okay to take a break and do this tomorrow, next week. Just be consistent with the previous step. And when you're ready, you can progress. This is not a race. Okay, especially because it is so brand new to your nervous system and your pelvic floor and your vagina. And we want to make sure that they are in a good place and they are willing to accept the tools that we're using. So this is my makeshift vulva slash vagina made out of my gym towel, which is kind of gross. But again, like we don't share these and I don't use this. Mine is for demonstration purposes. So that's good. But if we're looking at this here, this is a large model. And clitoral hood would be up here, urethra would be here, and then vaginal opening is here, labia minor is here, and labia majora is here, essentially. You get what I'm saying. At least I hope so. So what we're going to do is we're going to take our tool, and we're just inserting the tip. That's it. We are inserting the tip. We're letting it chill for a little bit, and we are going to do that diaphragmatic breathing. Now, your hand might not be available to be on your chest or your belly, which is okay, but just try to get that deep, low breath without pushing anything and not so much breath coming into your chest. A lot of it's expanding your ribs outward and allowing your lower belly to inflate. So we're just resting it, just the tip. It could be in the middle, it could be on the side, you could give a little pressure, but we're just putting a little bit in and we are resting and we are breathing. Okay. And we can do that just like we did with with just resting it outside. Now we're resting inside, and we can do that all along the vaginal wall on the right side. And then we can switch and do it all along the vaginal wall on the left side. If you want to get fancy, I just feel like I sound like I just hit puberty with that. If you want to get fancy, you can roll. So you give a little bit of a different input instead of just the pressure and pressing. You're rolling and pressing if you want, or you could just roll without putting pressure. Again, we're doing that to both sides. You always have a right and a left. So we want to give both sides input, right? It's not just putting things in the middle. It's letting those tissues accommodate to whatever input you're giving. And in this case, it's input from a dilator. So we're just rolling. And essentially what we're going to do is we're going to do that in multiple levels. So then when you're comfortable and only when you're comfortable, you can insert it even further. And we are putting pressure. We are pulling gently. We might just be, now that it's inside a little bit further, maybe we're just letting it chill there and we're seeing what happens, right? We don't need to be giving it a ton of input if this input is the most input it's gotten in a while. When you're ready, you can put that pressure. So you're pushing gently along the side. You might be rolling along the side. You might be rolling and putting pressure. There's like no right or wrong way to do this. The only way we want to steer clear of is anything that's causing you pain or anxiety or discomfort, or if it's just too much for you, it's okay to take a break. And it's okay to take a break during your training session with your dilator trainer and then come back to it. Again, this is not a race. We're not, you know, racing to the finish line here. And again, we're just doing that at different depths to tolerance. So we're just giving it a multitude of inputs so that it's kind of like it knows what to expect. If you want, once all of this feels good, the dilator has been inserted fully, and all of this feels good along the vaginal wall, what you can do on both sides, what you can do is you can start to do inserting, pulling out, inserting, pulling out. You can do stretching downward. So once you get comfortable with using this and what it feels like and what it feels like to, I like the word accept, what it feels like for your body to accept something like a dilator or something that's outside of it. I like that because it gives you power, and it gives so much power to your vagina and pelvic floor, as woo as that sounds, but it really does, because it's like, I'm choosing to accept this instead of this is doing this to me. My body has the ability to take this on, and it has its say. So if it's saying no, it's okay to back off, because that's the power that my body has, and my body is powerful AF, and we're going to do this. So I like the word accept instead of whatever else. I'm not even going to say another word because I like the word accept, and that's what we're using. So that's how you're going to do it. You're always going to clean this after. Always, always, always with a non-irritative cleanser. Antibacterial is not necessary, but you want something that's not going to dry out the material. So nothing with sulfates, nothing with what's another one? Blah. Oh, why can't I think? Like any glycolic acid. Glycolic acid. I was going to say glycerin, but I was like, that's not the word. Glycolic acid. So no sulfates, no glycolic acids. Not crazy fragrances if you can keep away from that. Nothing with alcohol in it. Please don't use dish soap on these because it will damage the material. And essential oils are not the best to be using on these either. It's just nice, gentle soap and water, warm water. Make sure that you fully dry them. Don't rub them with anything. Just like pat them dry. Oh, look, haha, multitask. So you're just going to pat them dry, and then you're going to let it sit on a paper towel or a towel and let it fully dry before you put it away. But you want to make sure these tools are always clean before and after use. Same with your hands. Always clean your hands before and after using. And I'm going to reiterate this. There is no shame in using the smallest size dilator you can get your hands on. There is no shame in that. You can always work up towards the larger ones. If you are forcing yourself on a timeline that doesn't exist, aka a timeline that you either made up in your head because you think that people expect you to be on this timeline, or because somebody told you that this is where you should be in X amount of time, tell them to suck it and and that's just not how it works. That puts urgency into the equation, and urgency is actually a nervous system upregulator, and that does the exact opposite of what we are aiming to do here. Okay. And if you need somebody to talk to them, I got you. So, why I hesitated with the pelvic floor muscle comment earlier is because of something that I want to show you that is not going to be done for the purposes of this video today, but I want you to be aware of it as well. So this little snake-like doodad is called a pelvic wand, and I actually like this for pelvic floor specific musculature because see how it's curved on the end and it has that little, has like a little blunt tip to it, and then we have a little blunt tip to the skinnier side. This is more specific when we're trying to address specific pelvic floor tightness instead of general stretching and accepting. General stretching and accepting is for the dilator. Some people actually use both tools, and they have both tools in their toolbox to help with calming down their pelvic floor tightness. And that's not a bad thing. They're just different tools used for different reasons with the same end goal, if that makes sense. So I do have a video on the pelvic wand down the line in my history somewhere. So if you want to check that out, make sure you check that out. And the other thing I wanted to point out as well is, especially for those of you who are perimenopausal, menopausal, or breastfeeding, our vulvar tissue is they have a lot of estrogen receptors. So during those periods of our lives, we might not have the best estrogen concentration. I don't know if that's the right word, but estrogen availability in those tissues, which actually can contribute to vaginal dryness. And this can make penetration that much more difficult. So you might want to speak to your OBGYN about possibly using a topical estrogen cream like estradiol or estrace cream. These are local creams. They do not go into your milk supply if you're breastfeeding, but you do want to consult your OBGYN before you need a prescription anyway, I believe. I could be wrong about that, but you always want to consult your OBGYN just based on family history and your own past medical history to see if something like that might be appropriate for you. But that might be a good idea to combat any dryness or any skin dryness that you're feeling as a result. And another option, if estrace or estradiol are not good options for you, another option is hyaluronic acid. Please do not use the one that you use on your face. They make them specifically for vaginas and vulvas. Another one, Good Clean Love. I just love that company in general. I'm not affiliated with them, but they do have a really great hyaluronic acid, and Via is another one that I really like. And these can be helped, just like you use a moisturizer on your face, these help to moisturize the vaginal and vulvar tissues to make penetration a little bit more comfortable, in addition to the tools that we used today and any pelvic floor relaxation moves that you can do that you have been taught, all the things. So that's what we got for dilator training. Some tidbits too to take home with you. It doesn't stop with just dilator training. There are other things that you can do to help relax your pelvic floor, namely stay well hydrated. Textbook is half your body weight in ounces of water. So if you weigh 200 pounds, that's 100 ounces of water a day. Again, not something that you need to do by tomorrow, but something to keep in the back of your head. Try to mitigate any clenching, so squeezing butt cheeks together, sucking your belly in, toes scrunching, shoulders coming up, forehead crunching, teeth grinding, anything like that. We want to mitigate as best as possible, because if that's happening, this could be translating as pelvic floor tension as well. The body is super cool. So we want to mitigate that. Make sure eating enough, sleeping enough, stress management is as good as it can be. They all affect pelvic floor tension. And that should do it for stuff outside of pelvic floor specific things. Remember, this is one tool in a toolbox that is insanely huge. So this is not going to be the end all be all if this is not something that you are comfortable with. There are other ways that we might want to investigate to help you out. Just something to think about. All right. If you found this video helpful, please like and subscribe so you don't miss out on all the pelvic floor things.